To fully understand what chronic pain is, we need to understand the differences between acute and chronic pain. What is acute pain? Pain is the body's normal response to an illness or injury. It's the way the body warns you that something is wrong and that you need to slow down and take care of yourself. In most cases, this pain goes away after the injury, such as a broken bone, is healed, or after you recover from the illness. For example, if you had a headache or the flu. Pain is the body's alarm system or warning signal in this case that something's wrong. In contrast, chronic pain is pain that persists for more than 3 months. Sometimes chronic pain can start with a surgery or an injury, but the pain continues even though the body heals. As we age, our bodies change, and some of us develop age-related chronic pain as well. We don't know why some people develop chronic pain and others don't. What we do know is that chronic pain can cause stress on the body, muscle tension and soreness that make it harder to get around. Emotional challenges of chronic pain, such as frustration or anxiety, are common. Let's review some symptoms associated with an experience of chronic pain. Chronic pain varies across people and is sometimes present in very different parts of the body from person to person. However, some common areas of the body impacted by chronic pain are listed below. These include back pain, joint pain, pain in the face, mouth, or jaw, pain in your muscles, your bones, or neck pain. People who live with chronic pain often have common psychological concerns as well. They may experience mood issues, which involve a range of significant and persistent disturbances in a person's emotional state. Some symptoms associated with mood issues that may be related to someone's experience of chronic pain could be emotional, including experiences of negative emotions like guilt or hopelessness. There could be physical manifestations such as insomnia, fatigue, or even cognitive or thinking difficulties. And finally, social impacts. Chronic pain and low mood could lead to social isolation and relationship tension. Let's reflect on mood-related symptoms. Where do you experience them? What mood symptoms impact you most? How do they affect your life? Please pause the video to reflect. We understand that experiencing chronic pain and dealing with low mood is often connected and goes hand in hand. But why is this the case? Take a look at this graphic that shows the connection between pain and mood. Pain triggers could lead to sadness or anxiety. Then, sadness can make the pain feel worse or exacerbate that feeling of pain you've already had when you experience low mood. This could lead to life disruptions, such as finding it difficult to stay asleep, stay active, or generally enjoy life. And then we get to treatment gaps, where doctors may focus on helping you with your mood or helping you with your chronic pain, but it's difficult for them to focus on addressing both problems simultaneously. So, there must be some underlying factor between the connection of pain and mood. That brings us to stress. Stress is the glue that sticks chronic pain and mood together. One reason why chronic pain and mood issues similarly impact physical and mental health is that they both increase levels of stress. Most of us can think of experiences that feel stressful. It also helps to know what stress means when it comes to our bodies. Stress is the body's response when the demands of the situation outweigh the ability to cope with the situation. These demands can be major life events, like you see on the screen below. The death of a loved one, the loss of a job, getting an unexpected medical diagnosis, or small daily tasks and challenges that deplete our coping resources over time. Our bodies are good at coping with one stressor at a time. However, chronic stress leads to wear and tear on the body. Long-term stress and depleted resources to cope with that stress can lead to physical and emotional problems like depression and anxiety. Dealing ineffectively with the symptoms of chronic pain and depression place the body back into a state of chronic stress. It's a vicious cycle, and one that we have to learn how to escape. So how do our bodies respond to stress? Well, that depends on who you are. Stress impacts all of us individually in many different ways. While stress is the common glue binding chronic pain and mood-related issues together, stress impacts us all differently. Let's take some time to reflect. How does stress in your life impact your chronic pain level? How does stress impact your mood? Do you have physical responses, emotional responses, and behavioral responses? Check out the boxes below and see what you identify with. Pause the video to reflect. There are a few things you may have discussed naturally or thought of naturally. Muscle tension can become a big issue when we're feeling stress in our bodies. Inflammation can grow worse because of stress, which in turn can intensify your chronic pain. Your pain signals may increase due to stress, and also we know that poor sleep never leads to anything good. Stress also negatively impacts mood. It alters your brain chemistry, it increases negative thinking, and it reduces coping resources. Today, we've gone through the effort to understand the connection between chronic pain and mood. We've then unpacked how stress is often a common culprit behind chronic pain and mood-related issues, and we've taken time to understand our own personal stress responses, which are different for everyone. Thank you for joining us today. We hope to see you back next week to dive more into health education.